and I hear it many, many times, is that the doctor said he'd use this tomorrow and he'd use it a lot, and whether that's coming from a sales rep or a lead from a trade show, or even with early on, innovators who maybe talk to an advisory board or some of their friends. The reality is that clinical buy-in, or even clinical validation through studies and through peer-reviewed evidence and data is not enough. The end user is very rarely the economic buyer. And you really have to identify who is that economic buyer.
Hello and welcome to the Healthtech Marketing Show. I'm your host, Adam Turinas. Thank you so much for listening. If this is your first time here, please do subscribe on whatever podcast app you use. And you can also find a lot of our content on YouTube. Just search for the Healthtech Marketing Show and you'll find it. A big thank you, as always, to Healthcare Now Radio, our sponsor. And I genuinely mean it every time I see it. Healthcare Now Radio is a 24/7 online radio station dedicated entirely to healthcare. And they also run an incredible podcast syndication network that we're very proud to be part of. It has multiplied our reach significantly. So thank you now, Healthcare Now Radio. Okay, today's episode is about the commercial reality of selling medical devices, and specifically the gap between how device companies think they go to market and how hospitals actually buy. And it is a big gap. It may be an even bigger gap than it is in other parts of healthcare. And here's the thing that struck me going into this conversation. In Medtech, clinical validation is necessary, but not sufficient. You can have a surgeon who loves your device, peer-reviewed data to back it up, and a field rep with a 20-year relationship and still stall out completely. Why? Because the doctor isn't the buyer. The CFO might not be either. And if you haven't figured out who actually controls the decision and built your commercial strategy around that person's problem, you're essentially shouting into the wind. My guest today is Todd Laderach. Todd has spent over 2 decades in the medtech industry across sales, marketing, and commercial strategy. And he now runs his own firm, helping device companies get life-saving products off the shelf and into the hands of clinicians. That framing, off the shelf and into the hands, comes from a mentor of his, and I think it's a great lens for everything we talk about today. We cover a lot of ground in this episode, from the anatomy of hospital buying committees to who really holds the yes, how to arm a clinical champion to sell internally, where ABM fits into this, where commercial revenue actually gets stuck, particularly in mid to large device companies, and how AI is starting to change the game for account prioritization. If you work in medtech or in health tech more broadly and want to understand the device world better, I think you'll find this genuinely useful. So let's get into it and meet Todd. Todd, welcome to the show. It's so great having you on today.
Thanks for having me. I'm excited to be here.
So tell everybody a bit about yourself.
Yeah, absolutely. So I've been in the medtech industry for quite a while, over 2 decades, and I now have my own firm where I help other medtech firms. And my passion has always been helping to get life-saving devices off the shelf and into the hands of the customer. I was told early on by a mentor of mine that you could have the best product in the world, could save lives and do amazing things, but it doesn't do anybody any good if it's sitting on the shelf. So that's what I've dedicated my career to and continue to do so.
And is your background sales or marketing or both?
Sales, marketing, strategy. I've kind of covered the spectrum of commercialization from very early on and then pretty far downstream as well.
The complete go-to-market executive. So medical devices used to be the ultimate relationship business, and a strong field rep, trusted surgeon, a dinner, that's kind of how things used to get done. And that's changed in this buying environment. And so as you look across companies right now, talk about the shifts that you're seeing in terms of the go-to-market model.
Yeah, absolutely. The biggest shift that we're seeing is being able to show value across the system. There are very few, if any, independent hospitals left. And so, what hospitals find in value in hospital systems is having standardization and really being able to have that value created, not only with the health outcomes, but also the economic outcomes.
Got it. Okay, that makes a lot of sense. And you know, this is true in many parts of healthcare, but I think maybe more so in the device space. But the gap between how a device company thinks it sells and how the hospitals actually buy is often misaligned. What's your perspective on that?
Yeah. One of the most painful things that I have ever heard in my career, and I hear it many, many times, is that the doctor said he'd use this tomorrow and he'd use it a lot, and whether that's coming from a sales rep or a lead from a trade show, or even with early on, innovators who maybe talked to an advisory board or some of their friends. The reality is that clinical buy-in, or even clinical validation through studies and through peer-reviewed evidence and data is not enough. The end user is very rarely the economic buyer. And you really have to identify who is that economic buyer, usually the hospital system or maybe even the insurance payer, whoever that is. And the most critical thing that has to be done is linking the clinical benefit to the economic outcome. And I think that's where the gap exists quite a lot between what is perceived and what is reality.
Can you give a recent example of that?
We were looking at I was helping an early stage founder just the other day, and he was looking at his total addressable market, and it was a really fascinating molecule that was going to help a lot. But he was thinking that the pain center was going to be one of the buyers, and we looked at it and said, they're not the buyer; it's the insurance company. And what is the payer? Whether it's a public or private payer, what are they doing now? How much is the cost, and how is this going to ultimately help save them money to get it on the formulary?
So basically, follow the money chain, right?
Follow the money. It's not just about the money. It's all about the money.
Yeah, exactly. All the way up to the payer. And so, what do you then do? What are some sort of tactical examples of how you might arm the champion with the tools to sell to the people that you as the vendor are really never going to? Because you're not, as a vendor, it's unlikely you're going to be ever present to the economic buyer, whether that's the payer or the CFO. You might get to present to the CFO. Chances are you won't get to them. How do you arm the buyer, the champion, with that?
Yeah, that's really where the intersection and having the strong relationship, right? We talked about the traditional model, and that still very much exists. And that's where it's very important, is to have that strong relationship with the champion to help you navigate who that is. Because if you've seen one model, you've seen one. They're all different. And so working together to understand what is that landscape and who are the key stakeholders in the process. Many times you'll see a committee, and there's a whole lot of people in the room, and any one of them can say no, but there's only one person typically that can say yes. And it's finding who is that person that can say yes, understand why, what is their pain that you're really solving, what's the value that you're creating, and then making sure that all the other stakeholders are aware and informed so that they don't say no. Because many times the no comes from not being informed or aware or a part of the process. So really finding that clinical champion that's going to help you navigate these waters is such a critical thing to do.
Let's drill down a bit on that. So what's the typical, if there is a typical, makeup of a buying committee, and who has that no power? Well, actually, it sounds like everybody has got that no power. But maybe who's got the strongest no, and who typically has the yes power?
Yeah. So, I'm paraphrasing here, but there's a saying about committees that it's usually a bunch of people, who individually can't do anything, but then as a group decide that they can't do anything either. Right?
So, I've never heard that. That's great.
I probably butchered it quite a bit, but realizing there are certain people that are very critical, and the physician still holds a lot of weight. I don't want to discredit how much the end user has a say in this. They absolutely 100% do. And you say, who can say no? That's probably one of the first ones, because if they're not on board, they're the ones actually holding the instrument, using the instrument, and doing what we all go to hospitals and healthcare to do, that's very, very critical to do. And there's a different reason for each person in the room who could say yes or could say no. And building out we call it journey mapping, or the customer journey, to know what are those critical pains, what's the problem that you're trying to solve, is the big thing. So many times, and whether this is in developing a strategy, developing your messaging, or even trying to develop the solution early on, we focus so much on the solution, and we want to, because that's fun. That's the cool thing to do. We talk about the problem that the solution is going to solve. But many times we're trying to create the problem for the customer. We don't actually start with the problem and focus in on the problem. And each person in that room has a different problem. So when you know that, when you understand that, and then you can link the solution to their problem, that's when then you get the people to lean in, you get the heads nodding, and you start to gain the consensus and the buy-in.
So what are some of the typical best practices that are proven? And then what are some of the innovations that are happening to help address that problem solution that each member has, and then how you get them to make a decision collectively?
Yeah, best practices that I've seen work really well is getting to the people who have the critical insights. So this could be your sales team that are on the front line. This could be using market research to gather that data, but it's gathering that data into actionable insights. Then you can start to align those to the customer. Journey mapping is a great process to use, and understanding not only the map of the customer or the patient, but also the users, right? And it could be that you've got a customer in the buying process who's a nurse, may not even touch the product, but still has a very big say in it, still has a journey that he or she goes on, in which you need to identify those problems and then how to solve them with that.
Got it. Okay. So there's a version of ABM that enterprise software companies use. We do a lot of work in that area. And then there's the reality of account-based selling in med device. So where the account might be, a 40 hospital IDN, right? Or a even larger group like an Ascension or somebody like that.
Mm-hmm.
And then there's going to be 7 layers of stakeholders at least. How do you think about mapping and penetrating those complex accounts strategically? And how does ABM work in med devices, maybe that's different from other areas of healthcare?
Yeah, so this is really where the perfect mix and collaboration of sales on the front line and then the strategy teams come together. There can be so many entry points into these complex systems, as you had mentioned, right? But knowing the entry point, typically coming from those on the front line, is critical. That's the first piece of it. Then using the ABM software, right? That then helps you to really determine how to cater the message and the content specific to the needs of all the people in the process and in the chain. And this doesn't happen with just sales thinking through how to do this, or just the marketing team in the home office, trying to think through how to do this from, the data, the insights, and the market research that they have. It starts with the strong alignment and strong collaboration between the two, and realizing that in order to get the best of both worlds, have to understand what's the common goal that we're trying to solve, and then how do we use all of these tools in order to do that.
Can you give some specific examples of that, like a particular ABM program that you might have been involved with?
I can't give a specific example of a typical of any specific ABM, but what I can do is share an example. Early on in my career, we were trying to figure out, how are we going to reach our goals for the year? And the first thing that we noticed was there was a strong or a distinct misalignment between marketing and sales with the goals. Right. So marketing was strongly focused on how to, what we say, steal share from others. And sales was really focusing on how do we generate new share from, new users from there. And so with that, those are two very different ways to go about doing this, and using all your tools that you have available to you through your CRM, through your ABM. And we needed to first, get to that point of alignment to say, we all know we want to grow share, but how are we going to do it best? And then to gain that alignment.
Got it. So let's talk about sales and marketing alignment in particular. It's across so many industries. It's often dysfunctional. And where that doesn't work, just marketing doesn't work. And I think the CEO is one of the most important things that they look for is, are our sales and marketing team working effectively
Mhm.
together? And just, devices has historically been very much a field rep dominant driven market. And marketing often plays a support role, making the trade shows happen, putting together the collateral, helping manage thought leaders. Do you think that model is still fit for purpose, or is it starting to crack? How's that evolving?
I love this question because, as we talked about early on, I've been able to sit on both sides of the fence, right? And I can, firmly state that what will not work is that if sales thinks marketing is just there to provide the air cover, right, or develop the sales sheets in the trade show booth or whatever that is, or if marketing is the one that feels that sales just needs to go out there and execute on what the strategy is that we've created, it's going to fail. And so, really, where the key to success is that they're bringing together the strong collaboration, the strong alignment, and having that done at the top, at the leadership level for how you're going to accomplish the common goal is the only way to do it. How that looks at the end of the day, then, right, it depends on, you mentioned, is it fit for purpose? It could be very much so that it's the model of, yeah, we need sales sheets, we need trade show booths and all that. And that's fine, but there has to be the alignment that that's the way that it's going to go. There's no doubt that, especially in med device, that the field sales rep is still paramount. They're the ones on the front line. There is such a personal touch to this, relationship based and working to navigate those complex hospital systems. But there's a big portion of strategy and support that the marketing teams can provide, and there has to be that strong alignment. And the alignment isn't just with sales and marketing. It's sales, it's marketing, it's finance, it's operations, it's service, it's customer service is a huge component that
Yeah.
oftentimes can be kind of forgotten about, but that's a big, big critical part of it too.
Well, you look at where commercial revenue actually gets stuck in the mid to large device company. Is it a targeting problem? Is it a messaging problem? An execution problem? What is it? Where does it fall apart?
To me, it's an alignment problem, right? So the targeting, the messaging, the execution, those are all problems, but they are a result of having misalignment at the top. So if there's alignment on how we're going to go out about and get it, and there's a understanding of the common goal that we're striving for, then it's easy to figure out, okay, where are the cracks, right? From there, if it is a targeting problem, well, then okay, well, it's the problem is because maybe we thought we were going to go after this type of target. Turns out they're not the ideal customer profile. It's this one. But you can't get to that point if you're not all first locked in on that common goal. And then you can go through the rapid cycles of iteration, right, to try to figure out, okay, where are some of these holes that we need to plug? And then you're able to do that together.
Yeah. I always think that one of the areas where alignment gets off on the wrong foot and then and may never recover is actually on account prioritization. Because particularly if you're taking an account-based approach to sales and marketing, which, let's face it, we have to in healthcare, right? And particularly medical devices. The sales teams often have a strong opinion about which accounts matter, but sometimes account prioritization is based on gut or relationship rather than real data or taking a much more strategic approach. Do you experience that? How do you help your clients deal with those issues?
Yeah, it's the combination of where the relationship and the strategy, kind of hit that sweet spot. It's the Venn diagram there. And again, that doesn't happen unless you have, and especially at the top, the leadership coming together and saying, here's what we're trying to get to, right? Here's our goal. Here's how we're going to try to get it. And then at that point, then you can look at, now, how do we plug in our strengths? How do we plug in the relationship strengths that we have? And, it's a very easy thing to look at first, but if you're going to try to grow market share as your goal, are you going for breadth or depth? And that makes a huge difference. Because if you're aligned on that and you say, you know what, we're going for breadth, then it's like, great, how do we now create those or use the relationships that we have, but get it to go wider into other areas, into other health systems versus, if you're going for depth, then you leverage that to get more and more share there. And you can see where if there's not alignment on that, it doesn't matter how good the relationship is, you're kind of just shouting into the wind at that point. So taking the best of those, finding the alignment on it, and then going out and executing together.
Adam here. Everything Todd's been talking about, navigating buying committees, aligning sales and marketing, prioritizing the right accounts, that's exactly the problem ABM is built to solve, particularly in medtech. At Health Launchpad, we specialize in ABM and helping healthcare technology companies in medtech, in software, and in biotech with this whole issue. We can help you identify the right accounts, build the right message for every stakeholder, and get sales and marketing actually pulling in the same direction. If you're a medtech device or a health tech company trying to figure out how to make ABM work for you, we'd love to talk. You can book a call with me through the link in the show notes below. Now, back to what Todd has to say. So let's shift gears and talk about AI. Frankly, you can't do a podcast these days without talking about AI.
And I know a conversation without AI.
Right, exactly, right. And I know I'm obsessed about it. So we're going to talk about AI. And there's a lot of noise about AI in healthcare. I'm curious about the commercial side specifically. Are you seeing AI device companies use data and AI to get smarter about things like account prioritization? Or is it more aspiration than reality? Or are device companies really doing what everybody's doing, which is just using it for content and research?
I think it's all over the place from what I've seen, right? And where I see the most success is the companies that are using the AI to take the data in which they have and make it much more effective. So not too long ago in the pre-AI data, there was the business intelligence systems that were aggregating all of this different data, market share data, and volume data, all these other things. And then you sat down with the data scientists and the smart people in the room and said, now let's figure out how do we use this data to make it actionable. This is where AI can come in and use it so much more effectively to analyze this data and help from the standpoint of being able to understand signals that may be out there that are hard to see with the naked eye. That's where I think it's becoming the most effective in really moving the needle. Building the content and doing all that other stuff is fantastic as well. But this is a huge opportunity to make that data much more actionable.
I agree. And actually, field reps, particularly med devices, sit on an enormous amount of account intelligence. And that never really gets captured in a structured way. Can you see sort of opportunities to unlock that data and make the commercial strategy smarter?
100%. And if there are any field reps listening to this, they're probably going to hate me for saying this, but this is where the CRM system is so critical, because this is how you're able to catch those insights and the things that you are not published, right? But you can capture these insights and these signals that then can feed in to other data points as well. It's how you know what's going on. The other piece of it too is with the CRM is it's how you know what's working and what's not working. Sure, you can look at your lag measures far down the road. Did we move the needle on market share and revenue and all these other things? But this is how you know, is this message working? Is it resonating, right? Did they buy into the value prop that we're trying to put forward? So I would say bringing in that element, and AI is helping with the input of info into CRM too, right? So I think that there's a huge opportunity too to be more effective. Our field teams always hated, having to spend 15 minutes or whatever it is to input their call notes at the end of the call. But AI is helping out a lot with stuff, set it to record and auto-populate and can capture all that information as well.
Yeah, just basic stuff like, how did you learn about this product? What brought you here? What other companies are you evaluating and how are you learning about it? That's the sort of stuff which can be invaluable from a marketing standpoint.
100%. And, there's other data sources that are out there too, right? When you think about how are we going to build the ideal customer profile, or going back to what we talked about earlier, what's the problem to solve? You can bring in things that are, maybe they're not in a market share report, or they're not in a market intelligence report that's coming out, but you can go out and see, like, where do the problems exist? Who's been just recently dinged by JCO? or failed an audit? Who has seen a drop in the reputational risk from hospital grade ranking, dropping in profits? Who has extremely high turnover in the nursing area? And so if your solution has a value proposition of being much more simple to train, you can say, yeah, we know you have really high turnover. Let me help you save 10 minutes every time you have to train a new person. These are incredibly valuable things that exist out there, but maybe we haven't been able to harness all that data and make that useful before.
Yes, absolutely. So my last question to you is, the companies you see getting the commercial strategy right, what separates them? What's their secret formula versus the ones that just aren't really at the top of the game?
Yeah, these are, you heard me say this a few times already, so it might sound a little repetitive, but two critical things that always stand out. The first is focusing on the problem, identifying the problem first, then link the solution. And the second is the collaboration and alignment at the top. And again, we talked a lot about sales and marketing, but as I said before, it's throughout the whole commercial chain, if you will, and having that everybody knowing what's the goal that we're striving for, and then how is each of our respective responsibilities going to achieve that makes a world of difference.
Thank you, Todd. That's a nice, crisp place to end this interview. And it's been a pleasure having you on the show.
Adam, thanks so much. I love the questions, love the conversation. Thank you so much.
So that was Todd Laderach. And I think there's a lot to take away from that conversation. And a great deal of it applies well beyond medtech. So here are 4 things I want to leave you with. Takeaway number 1, clinical buy-in is not the same as commercial buy-in. This is probably the most common and most expensive mistake in med device commercialization. A surgeon who's enthusiastic, early adopters, positive advisory board feedback, none of that is a sale. The person holding the instrument is rarely the person controlling the budget. Until you've identified the economic buyer and built a case that connects clinical value to financial outcome, you're not really in the buying process yet. Takeaway 2, follow the money all the way up the chain. Todd's example of the early stage founder who assumed the pain center was the buyer when it actually was the insurance company is one that I think plays out constantly. Your ideal customer profile needs to be built around who pays, not just who uses. And those are often very different stakeholders with very different definitions of value. Takeaway 3, sales and marketing alignment isn't a nice to have, it's the whole game. Todd was pretty direct about this. The targeting problem, the messaging problem, the execution problem, in his view, those are all downstream symptoms of a misalignment problem at the top. When leadership isn't locked in on a common goal, it doesn't matter how good the field team is or how smart the marketing strategy is, you're working against each other without realizing it. Takeaway 4, AI's biggest commercial opportunity in medtech isn't content, it's data. Todd made a distinction I think is worth sitting with. Using AI to produce content is fine, but the real unlock is using it to make your existing data actionable. CRM signals, market share data, JCO audit results, hospital reputation scores, nursing turnover rates. All of that is out there, and AI is what makes it possible to connect those signals to your ICP and act on them in a way that wasn't realistic even a few years ago. The through line across everything Todd said is this: start with the problem, not the solution. That applies to your product strategy, your messaging, your account prioritization, and your sales and marketing alignment. If you get the problem right, whose problem it is, what it actually costs them, and how you uniquely solve it, everything else gets a lot cleaner and a lot more effective. If this got you thinking about your own go-to-market strategy, whether you're in medtech or anywhere in health tech, I'd love to compare notes. There's a link in the show notes to book a call with me. There's nothing for sale here, just genuinely happy to have a chat through whatever you're seeing. And if you found this episode useful, please share it with a colleague who's wrestling with any of this. And a 5-star rating on Spotify or Apple goes a long way to helping new listeners find the show. I'm Adam Turinas, and I'll see you on the next Health Tech Marketing Show.